Guys, welcome to my YouTube channel, Ambitious Dr. Ashwini. And today we will see the protozoa Giardia Lamblia. So, we will start one by one. So, as I described before, that parasites are classified into two, protozoa and helminths. So, today's protozoa is Giardia Lamblia. So, it comes under flagellates. So, you can see the flagellas which are present to the protozoa are classified under flagellates. So, Giardia also classified under flagellates. So, according to the CBDC pattern of second year BHMS pathology students, the contents are: describe the morphology of Giardia lamblia, describe the life cycle of Giardia lamblia, describe the pathogenicity and clinical features of Giardia lamblia. So, we will see it one by one. So, firstly, we will see the introduction of Giardia lamblia. Giardia lamblia is a tiny parasite that lives in the intestine and causes an illness called giardiasis, which mainly leads to diarrhea. It is found all over the world and is more common in warm tropical areas. In India, the rate in children can range from 0.5% to 70% depending on living conditions and hygiene. So, in short, Giardia is a common parasite in children that spreads easily and causes diarrhea. So, this is the structure of Giardia. Now, we will see the morphology of Giardia lamblia. Giardia lives in the upper intestine, that is duodenum and jejunum of human. You can see this is the extended part of stomach. So this is the duodenum and this is jejunum. So here the Giardia lives. So it has two forms, trophozoite and cyst. Trophozoites are the active disease causing form. It is pear shaped, moves with flagella, and is found in stools during active diarrhea. Cysts, the oval, four nuclei form. It is the infective form, causes new infection, and also the diagnostic form seen in the stools of patients and carriers. So, in short, trophozoite is active and pathogenic, and cysts are infective and diagnostic form. Now we will see the life cycle of Giardia lamblia. So the host here is man, only one host. The infective form is cyst. So cysts are the infective form. Mode of transmission by fecal-oral route. It means by eating or drinking food or water contaminated with mature cyst. So fecal-oral route means from the feces of one person to the mouth of another person. Next, development inside the human body. It comes under the life cycle. So here excistation happens, which means ingested cysts reach the duodenum and changes into trophozoites. Next, multiplication of trophozoites, that is trophozoites multiply by binary fission. Then adhesion means they stick to the intestinal lining using their ventral sucking disc. Next, encystation happens. As they move down to jejunum, trophozoites turn into cysts, that is, mature cysts with four nuclei are passed in the feces. Next is survival. Cysts survive in the environment and infect another person. So this is the life cycle of Giardia lamblia. Here man acquires infection by the ingestion of cyst, that is contaminated food and water. Then excistation happens in duodenum. Then trophozoites get releases. Next trophozoites multiply by longitudinal binary fission. Then trophozoites adhere, matlab stick on to duodenal mucosa. From here trophozoites released in lumen. From here trophozoites in jejunum and encystation happens. Then cysts passed in the feces and again it acquires infection to the man. So these are the structure of trophozoite front view. This is the front view A diagram is front view of trophozoite. Then B is the lateral view of trophozoite and C is the cyst. So this is the life cycle in illustrated form. You can see ingestion of dormant cyst. You can see the ingestion of dormant cyst, then excitation tropozoite emerges to an active stage. Here tropozoites undergo asexual replication. Not everyone exhibits symptoms. Here encystation during transit towards the colon, then cysts and tropozoites expelled in the feces. Only cyst can survive outside the body. Outside the host. So here cyst can survive for weeks to months in cold waters, and again this cyst ingested means ingestion of dormant cyst to man. So in short, Giardia Lamblia life cycle, infection spreads by swallowing the cyst. Cyst changes to tropozoites in the intestine, multiply and causes disease, convert back to cyst, excreted and infect a new person. Now we will see the pathogenicity of Giardia lamblia. So infective dose is very small. Only 10 to 25 cysts can cause the infection. Risk group mainly children and elderly weak person and people with low immunity. Then pathogenetic form tropozoites. They stick to the duodenal lining, damage it and causes malabsorption plus diarrhea. So malabsorption may be of various types such as they may be of various types, such as fat malabsorption, that is greasy, foul smelling, frothy diarrhea, which is steroria. Then dis- disaccharides deficiency, that is lactose intolerance. Then vitamin and mineral loss, that is vitamin A, B12, and iron deficiency. Then protein loss, that is protein losing entropathy. Then antigenic variation, that is Giardia keeps changing its surface coats with a protein called VSP, that is variant surface protein, to escape the immunity, which makes the infection chronic and recurrent. So in short, a few cysts can cause infection. Children are most at risk. Then tropozoites damage the intestine, malabsorption, that is fat, sugar, vitamins and proteins, and causes diarrhea. Here, frequent surface changes allow GIDR to hide from the immune system, so the illness may recur repeatedly. Next, the clinical features of Giardia lamblia. Most people infected with Giardia have no symptoms. They carry cysts in their intestine and spreads the infection. In some, after an incubation of 1 to 3 weeks, symptoms appear, that is fatty diarrhea, steatorrhea. Main feature due to fat malabsorption. Stools are foul smelling, frothy with gas, mucus but no blood. Other intestinal symptoms, that is abdominal pain, bloating, belching, excess gas, vomiting, and severe weight loss, may cause growth retardation in children. Third one is rare extraintestinal signs, that is skin rash, urticaria, arthritis, anterior uveitis, that is happens in iris, and salt and pepper retinal changes, which are black and white spots on retina. So in short, most people don't show symptoms but still spreads the parasite. When symptoms occur, the hallmark is foul smelling, fatty diarrhea with bloating and weight loss. Rarely it also affects skin, eyes or joints. Now the laboratory diagnosis of amoebiasis, that is Giardia lamblia. So stool examination is done. Here the gold standard for diagnosing giardiasis is stool microscopy, where cysts and tropozoites of Giardia are seen. So in short, stool microscopy detects cysts and tropozoites and confirms the diagnosis. So thank you. Like, share and subscribe, and press the bell icon for the updating notifications. Thank you. Stay tuned for more such videos.